Hi there, this is Nursing Education Videos. Today I will be going over the multiple sclerosis MS NCLEX questions on registerednursern.com. I will be reading the review notes and doing the quiz at the same time. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursern.com. Again, all credit for the information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. Multiple sclerosis NCLEX questions for nursing students. Multiple sclerosis is a neurodisease that affects the central nervous system. In the previous NCLEX review, I explained about other neurological disorders, so be sure to check those reviews out. As the nurse, it is important to know the pathophysiology of multiple sclerosis, the types of drugs used to treat this condition, signs and symptoms, and the nursing interventions. Don't forget to watch the lecture on multiple sclerosis before taking the quiz below. This quiz will test your knowledge on multiple sclerosis, MS, in preparation for the NCLEX exam. Select all the true statements about the pathophysiology of multiple sclerosis. A. The dendrites on the neurons are overstimulated, leading to the destruction of the axon. B. The myelin sheath, which is made up of Schwann cells, is damaged along the axon. C. This disease affects the insulating structure found on the neuron in the central nervous system. Or D. The dopaminergic neurons in the part of the brain called substantia nigra has started to die. So if we go to the notes over here, so this is the statement here is this is our problem with MS, that myelin sheath has experienced demyelination. So guess what? The signal is not being transmitted properly to the area that the nerve supplies. It would be B. The myelin sheath, which is made up of Schwann cells, is damaged along the axon. Question number 2, true or false? Multiple sclerosis tends to affect men more than women and occurs during the ages of 50 to 70. So we are going to look at the notes here. It says women tend to be affected more than men, and MS seems to show up in the age category of 20 to 40. So question number 2 is false. Question number 3, true or false? Patients with multiple sclerosis have different signs and symptoms because this disease can affect various areas of the peripheral nervous system. So over here it says symptoms vary among patients because different areas of the central nervous system are affected. So this is true. Question number 4. A patient is suspected of having multiple sclerosis. The neurologist orders various tests. The patient's MRI results are back and show lesions on the cerebellum and optic nerve. What signs and symptoms below would correlate with this MRI finding in a patient with multiple sclerosis? Would it be A, blurry vision, B, pain when moving eyes, C, dysarthria, D, balance and coordination issues, E, pill rolling of fingers and hands, G, heat intolerance, H, dark spots in vision, or eye ptosis. So if we look at this here, optic nerve, we can think of the vision. So it could be something that deals with blurred vision or pain with moving eyes. And then we will check on the notes as well. So cerebellum area is for coordination. So it says here, if the nerve to the eyes, so the optic nerve, is being affected, the patient will have vision issues like blurred vision or blindness in one eye, etc. And there's also saying painful when moving eyes. So dysarthria is when the cerebellar area is affected. Dark spots in vision. So for question 4, patient's MRI's results are back and show lesions on the cerebellum and optic nerve. The answers would be A, blurred vision, B, pain when moving eyes, D, balance and coordination issues, and H, dark spots in vision. Question number 5. You're performing a head-to-toe assessment on a patient with multiple sclerosis. When you ask the patient to move the head and neck downward, the patient reports an electric shock sensation that travels down the body. You would report your finding to the doctor that the patient is experiencing A, Romberg sign, B, Lermit sign, C, Toff sign, or D, Homan sign. So reports an electric shock sensation that travels down the body when the patient moves the head and neck downward. So the notes here, it says Toff sign is where symptoms get worse due to heat. And then the Lermite sign is when an electric shock sensation that travels down the body when moving head or neck in various positions, called Lermite sign. So this would be B. Question number 6. Which finding below represents a positive Romberg sign in a patient with multiple sclerosis? A. The patient reports dark spots in the visual fields during the confrontation visual field test. B. When the patient closes the eyes and stands with their feet together, they start to lose their balance and sway back and forth. C. The patient's signs and symptoms increase when exposed to hot temperatures. D. The patient reports an electric shock feeling when the head and neck are moving downwards. So the patient's signs and symptoms increase when exposed to hot temperatures. That is the Udolph sign. And the patient reports an electric shock feeling when the head and neck are moving downward. That is the Lermite sign. So it says here, unable to be aware of body position, so proprioception when the eyes are closed is a Romance sign. When patient puts feet together and eyes closed, this causes them to sway. It would be B. Question number 7. Your patient is scheduled for a lumbar puncture to help diagnose multiple sclerosis. The patient wants clarification about what will be found in the cerebrospinal fluid during the lumbar puncture to confirm the diagnosis of MS. You explain that blank will be present in the fluid if MS is present. A. High amounts of IgM. B. Oligoclonal bands. C. Low amounts of white blood cells. Or D. Oblong red blood cells and glucose. So on the notes here, lumbar puncture assesses spinal fluid for specific proteins called oligoclonal bands, which are immunoglobulins. So the answer is B. Oligoclonal bands. Question number 8. You're developing a plan of care for a patient with multiple sclerosis who presents with a Doff's sign. What intervention will you include in the patient's plan of care? Select all that apply. A. Avoid movements of the head and neck downwards. B. Keep room temperature cool. C. Encourage patient to use warm packs and heating pads for symptoms. D. Educate the patient on 3 ways to avoid overheating during the exercise. So, Doff sign. If we go back to the notes again, it talks about patient signs and symptoms increase when exposed to hot temperatures. So we would be considering B and D. So this question says select all that apply. So keeping the room temperature cool and educating the patient on 3 ways to avoid overheating during exercise. Question number 9. During your discharge teaching to a patient with multiple sclerosis, you educate the patient on how to avoid increasing symptoms and relapses. You tell the patient to avoid A. Cold temperatures, B. Infection, C. Overexertion, D. Salt, or F. Stress. So if we look at the notes over here, so preventing symptoms from getting worse, watch the heat, keep the room cool, so avoid heating blankets, pads, etc., avoid infection, avoid stressful events, and avoid getting too tired, overexertion. So this would be B, C, and F. Avoid infections, avoid overexertion, and avoid stress. Question number 10. A patient with multiple sclerosis has issues with completely emptying the bladder. The physician orders the patient to take blank, which will help with bladder emptying. A. Bethane, Col, B. Oxybutynin, C. Avonex, or D. Amantadine. So we are looking for medication that that addresses issues with completely emptying the bladder. So oxybutynin is an anticholinergic that helps with an overactive bladder. It relaxes the bladder to prevent contractions. Bethanechol is a cholinergic that helps with completely emptying the bladder by helping bladder contract fully. And then amantadine is for fatigue. Avonex is an interferon beta 1A, which decreases inflammation and the immune system response. So the answer would be A, bethanechol. It's a cholinergic that helps with completely emptying the bladder by helping bladder contract fully. Question number 11. A patient is receiving interferon beta for treatment of multiple sclerosis. As the nurse, you will stress the importance of A, physical exercise to improve fatigue, B, low-fat diet, C, hand hygiene and avoiding infection, D, reporting ideation of suicide. So interferon beta reduces inflammation and reduces the immune response. So as the nurse, you will stress the importance of C, hand hygiene and avoiding infection. Question number 12. Which medications below can help treat muscle spasms in a patient with multiple sclerosis? Select all that apply. A, propranolol, B, isoniazid, C, baclofen, D, diazepam, or E, modafinil. So muscle spasms, it is baclofen. It's a skeletal muscle relaxant that acts centrally, as well as diazepam. So it would be 2. C and D, baclofen and diazepam. So I'm going to input the answers and see my results. Here are my results. Your grade is D. The percentage of what you got right was 67. So this was a more difficult quiz. Let's see what questions I got wrong. Question number 1, I chose B, but it's to select all the true statements about the pathophysiology of multiple sclerosis. The answers are B and C. In multiple sclerosis, the myelin sheath, which is the insulating and protective structure made up of Schwann cells that protects the axon, is damaged. MS affects the CNS, so central nervous system, and when the myelin sheath becomes damaged, it leads to a decrease in nerve transmission. So C, where it says this disease affects the insulating structure found on the neuron in the central nervous system. And then number 3, true or false? Patients with multiple sclerosis have different signs and symptoms because this disease can affect various areas of the peripheral nervous system. The answer is false, and I chose true. Yes, patients with MS have different signs and symptoms because lesions can present at different locations in the central nervous system, hence the brain and spinal cord, not the peripheral nervous system. So it's the central nervous system and not peripheral nervous system. Question number 4. The answers are A, B, C, D, and H. So blurry vision, pain when moving eyes, dysarthria, and balance and coordination issues, and dark spots in vision. I chose A, B, D, and H. If lesions are present in the optic nerves, optic neuritis can occur, which can lead to blurry vision, pain when moving the eyes, and dark spots in the vision. If cerebellar lesions are found, this can affect movement, speech, and some cognitive abilities. This would present as dysarthria, issues articulating words. So cerebellar lesions might also be included in the cerebellum. Question number 8. Correct answers are B and D. Uthoff sign is where when the patient experiences too much heat, their symptoms increase and get worse. Therefore, it is important for the patient to stay cool and doesn't overheat. Room should be cool and the patient should be encouraged to exercise, but to avoid overheating. I think when I was inputting the answers, I didn't write B. Alright. So, those are my results. My grade is D. Percentage of what I got right was 67. Alright, thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button and go to registerednursern.com for more information and check out their YouTube channel. Thank you again for listening, and I hope you have a great day.